What is the ideal time to remove a surgical suture? Is it the same for all body parts? Does it differ from person to person? Is it same for simple sutures and continuous sutures? And is it same for sutures and staples? If you're looking for the answers for this question, then stay tuned till the end of the video. So what happens if you remove the suture in a wrong time? If you remove the sutures early, then it can lead to wound gaping, which further leads to infection and sometimes warrants resuturing. If you remove the sutures late, then it can lead to stitch abscess formation, sinus formation, then which further leads to surgical site infection and can further lead to increased scarring. So in this picture, this is the scar formed by the wound itself. But these scars on the lateral aspect, these are formed by the long-standing surgical sutures. So if you plan and remove the sutures on the correct time, then you can actually reduce or avoid these scarring on the lateral aspect. So coming to the next question, is it different for different suture types and suture materials? So there is no difference between a simple suture and a staple, but there is a subtle difference between a simple suture and a continuous suture. So imagine that you are starting suture removal for a patient who has simple sutures. You started removing these two stitches and the wound started gaping. So at this point, you can stop the suture removal and delay the suture removal by a couple of days so that the wound actually heals. But in case of a continuous suture, if you start suture removal at one point and the wound gapes, then the entire wound gapes because it is a continuous suture. So in case of continuous suture, you should be doubly sure before removing the suture. And just keep in mind that different body parts has different suture removal timings. And it is different for a wound without an infection and a wound with the infection. We'll discuss each of this separately. And it differs from a patient who is immunocompetent and a patient who has immunodeficiency or a poor healing tendency. Hi, welcome to The Scalpel, where you can learn about concepts in surgery, clinics, practice essentials, and operative surgery. If you're looking for a specific section, feel free to use the timestamps given below in the description to navigate through the video. So now we'll discuss about suture removal timings in different body parts in the absence of infection. First is face, scalp and neck. So these parts have a high blood supply and has a good healing tendency. So the best time to remove the suture is 5 to 7 days. And if you have done a very good subcutaneous suturing, you can remove the sutures between 4 to 5 days and apply steri strips. As you can see the picture, these are steri strips. These are adhesive tapes just to hold the wound edges approximated. Next, abdomen and trunk. Usually the sutures are removed between 8 to 10 days. But if you need a really good cosmetic result, then you can do a good subcutaneous suturing and use a monofilament fine non-absorbable suture material. Then you can prepone the suture removal and do it within 6 to 8 days. And while doing this, you should do alternate suture removal technique in which you can remove one suture and leave the other one. So 1, 3, 5, etc. you will be removing, and the rest of the sutures you can remove it on the next day. It's the same for inguinal and scrotal wounds, for example, for inguinal hernia surgeries. Then for breast, the best time to remove the sutures are between 6 to 8 days, and you can remove the sutures between 5 to 7 days if you have done a good subcutaneous suture. In this also, you can use the steri strips. Upper limb and lower limb, usually it's good to remove the sutures between 6 to 8 days, and with subcutaneous suture, you can remove it between 5 to 7 days. Whenever you have sutured near a joint, for example, a elbow joint or knee joint, then it should be removed only after 10 to 12 days. This is because the joint mobility decreases healing, and that's why you delay the suture removal. If the joint has been operated, for example, a knee replacement or hip replacement surgery, then it's done usually after 2 weeks. And in this case, the joint is usually mobilized with a plaster of Paris cast. So as we have discussed about suture removal in the absence of infection, now we'll discuss about suture removal in the presence of an infection. So this also can vary from simple cellulitis to a deep-seated abscess. So if there is simple cellulitis, then you can start the patient on therapeutic antibiotic. Always assess for deep-seated SSI and delay the suture removal by 2 to 4 days. And if the patient has deep-seated abscess, then you are supposed to start the patient of therapeutic antibiotic, lay open the wound sutures by 2 or 3 stitches and drain the abscess, send it for pus culture and sensitivity and start on the sensitive antibiotic. And in this scenario, always look for a deep-seated or organ space infection. In these situations, when you are doing a suture removal, it's better to do alternative suture removal first, later on followed by the complete suture removal. This is a special situation which occurs in abdomen, which is called as wound dehiscence or wound failure or burst abdomen. So there is a dehiscence in the linea alba. So the patient complains of profuse fluid seeping from the wound, which is salmon pink colored, and it's increased on coughing or straining. And there can even be evisceration. Evisceration means a part of the bowel or omentum is projecting through the wound. And in this case, it usually warrants an exploratory laparotomy, fix the pathology underneath, and then suture the linea alba. Then coming to secondary suturing. So whenever there is wound gaping after removal of a suture, or whenever the wound was laid open for a superficial SSI, this can be followed by a secondary suturing once the infection is settled. So the suture removal in this situation is delayed by 4 to 5 days for each separate body part. The suture removal is not same for all individuals. The individuals who has decreased healing tendency, the suture removal should be done a bit late. The examples are a patient who has malnutrition or vitamin deficiency, the patient who is having an immunocompromised state like HIV infection, the patient is on steroid, the patient is on chemotherapy, uncontrolled diabetes mellitus or smoking, then it's better to remove the suture delayed by a week's time. Thanks for watching the video. So what do you think is the ideal time to remove a facial suture to have the best cosmetic results? Leave your answers in the comment section. And if you like this video, share with your friends and subscribe to our channel to stay updated by just clicking right over here. Thank you.